I first realized I was an oppressor in the summer after 10th grade. I had just been selected to participate in the Summer Youth Dialogues program on race and ethnicity at the University of Michigan. We were selected from a number of high schools in the Metro Detroit area, and my group of suburban students was partnered with a group of students from Detroit. At first, I was confident, maybe even a little excited. I'd been involved with social justice issues in the past, and so I felt that it gave me a kind of advantage. We talked constantly about the city, about its problems, about who should get what. But it was only a little later that I began to realize that some voices were being drowned out. In our excitement, we suburban kids had been suppressing the ideas of our partners from Detroit, some of whom identified with the very problems we were trying to fix and likely had insight into the solutions. I learned an important lesson about leadership that day. That leadership is not just about stepping forward, but also about stepping back so that everyone's voices can be heard. It's been almost 4 years since that day, and many big problems remain. To solve them and to save Detroit, we need to invest in its people. I'm a clinical research assistant in the emergency medicine department of the Wayne State School of Medicine. And a big part of my job is to monitor the patients that come into the ED, to talk to them, to talk to their physicians, and to see if they might fit for any one of our studies. One day, a patient came in for a stroke, and it was really serious, especially because he was in such a delicate situation. He and his significant other were confused and overwhelmed, with a number of different physicians going in and out of his room. And I was there, constantly walking by, feeling like a salesman more than anything, when all of a sudden I heard, "Excuse me, sir." I turned, and it was a patient 2 doors down who was calling me. I went in, not sure what to expect, and he said, "I've seen you pacing back and forth in the hall, and you seemed worried, and I just wanted to say thank you. You know, many people look at Detroit and they say it's full of problems and best left alone. But what many people don't realize is that the people here don't have anyone else. So thank you." That moment forced me to take a step back and to reevaluate my intentions. I realized how crucial it is to take into account a patient's unique needs and circumstances, in addition to any other goal. Scaled to a community level, this same approach can be immensely impactful. Currently, Detroit lags behind the country in many significant health outcomes, including life expectancy and maternal mortality, according to the Virginia Commonwealth University and the Michigan Department of Community Health. What's really alarming, however, is that on average, Detroiters are being affected by chronic conditions, like high blood pressure and heart failure, almost a decade or two before their peers nationally. To solve this, we have community intervention programs, such as the American Heart Association's Check Change Control. It educates people about high blood pressure and lets them know what steps that they can take to manage it. Programs like these do make a difference, but they're often limited in scope, which means that many people won't find out about them until their conditions brought them into the hospital. We can expand and streamline these programs, but to do so, we need to actively listen to residents' feedback so that we can better understand and be more cognizant of their concerns and needs. Part of this also means that we need to increase awareness of these initiatives so that people can better recognize when they need help and know that they have a system to depend on when they do. Now, another area where investing in people can pay big dividends is in education. As New York Times journalist Nicholas Kristof notes, education was and is the best escalator to opportunity in America. That escalator is broken, and not just in Detroit. Last fall, I attended a panel discussion on inequality in American cities, hosted by the Kresge Foundation. And one of the panelists, Alec McGillis, mentioned how when most people think about inequality in American cities, they think about New York City, or San Francisco, or Chicago. What's different about these cities is that disparities there are really black and white. Over there, inequality is largely the difference between someone living on a penthouse or living on the street. But that's not the case everywhere, and certainly not in Detroit, where inequality is largely relative to the surrounding suburbs. Another panelist, Eric Robertson, drew a parallel with Memphis, a city that went through a white flight similar to Detroit in the 1970s. Although Renaissance efforts have been made since then, with approximately $8.8 billion being allocated at one point, they went to largely affluent areas, while areas that were most in need were largely untouched. I found this to be very similar with what happened with the DIA in 2013, when Detroit's then emergency manager declared bankruptcy and tried to leverage the DIA art as assets to bail out the city. Immediately, there was a huge uproar. People simply couldn't believe that the DIA, a key part of Detroit and its history, could just be sold off. What I found most shocking, however, was that much of this outrage, much of this anger, came from outside the city. And although funds were raised, approximately $100 million in total, that just separated the DIA from the city and made it its own entity. But just like the funds that saved it, the DIA became an outsider, both to the city that it was named for and to the problems that still afflict that city to this day. Events like these raise questions about who should get resources and about what we as a community can do to ensure that our investments are truly impactful. The answer, I believe, is twofold. As panelist and Detroiter Keith Owens mentioned, the first and most crucial step is to not become complacent and to acknowledge that just because growth and benefits are happening in some places, for example, Midtown or downtown, they're not necessarily being reaped everywhere. It also involves supporting people like Arlissa Hurd, a member of 482 Forward, a local parent group that is raising awareness about the issues facing Detroit public schools. She advocates for taking decisions out of the hands of state legislators who are unaffected by the laws that they enact, and putting them in the hands of parents and educators, the two groups of people who have the most vested in the school system and have a unique insight into its problems. So tomorrow, when you go back out there, out into the commotion and hustle, out into the world that still sees a Detroit that's struggling to stay afloat, I'd like you to have a little courage. Courage to believe that even our most daunting problems can be overcome. Courage to open yourself up to new perspectives, especially those that have been underrated and overlooked in the past. We have all, at some point, found the courage to lead. Now, let's try to find the courage to listen. Thank you.